Before the car accident, I was very active. I could ski, I could water ski, bike ride. I lived a very active life. I like to stay in shape. After the car accident and I was incapacitated, I couldn't garden, I couldn't do anything that was sitting too long. Exercising was almost non-existent, and I started to gain about 30 pounds, which did not feel comfortable on at all. Everything stopped. The only thing I did basically was get up, go to work, come home, and take it easy because the pain was just that bad. A coworker had introduced me to Dr. Drzala. I called him up, and within a week I was scheduled for surgery.
When Eileen presented to me, she was in tremendous pain. She was having pain in her neck, going to both arms. It affected her quality of life to the point that she could no longer garden, which she enjoyed. She was an avid skier. She could no longer do that. And most importantly, she was taking days off from work. She was afraid she was going to lose her job because of this pain that was disabling. Eileen had been treated comprehensively for an extended period of time for this pain that she had. She's had this pain for years. She had seen a chiropractor, she had seen a physiatrist, which is a doctor who specializes in physical medicine and rehabilitation. She had been treated with physical therapy, with medications. She saw a pain management specialist who gave her injections, they're so-called cervical epidural steroid injections, to her neck. She also underwent acupuncture. She modified her activities tremendously, and even with this, she continued to have pain.
I'm in healthcare, and I am an X-ray tech. I do MRIs, CT, and a lot of the people we get into my office are either prior to surgery, or many of them are post-surgical patients to neck and back surgeries that were not successful, for lack of a better word, didn't have any pain relief given to them, didn't improve their quality of life, and most of those patients had fusing.
There are differences between fusion and disc replacement. With a fusion, you eliminate motion at the levels that are being fused. That could lead to problems. One is non-union. Even though you try to get the level to fuse, sometimes it doesn't. Secondarily, you can develop something called adjacent segment disease. So once you fuse a level, the levels above and below the fusion can degenerate faster. Imagine 3 people coming on the job to do work, to move heavy piles of soil. And imagine one of those people no longer shows up forever, but the other 2 people have to do the same amount of work every day. They have to work a lot harder. It's the same with discs. If you have 3 discs doing the work and you fuse one of them, you eliminate one of those players, and the other 2 have to work a lot harder, and they're going to wear out a lot faster. Instead of eliminating one of the players, you replace them with a substitute. And we found over the last 8 to 9 years in scientific studies that in fact is the case. It is helping the spine. It's allowing the other levels to feel less stress. So there's less degeneration, and that could lead to a better quality of life. In fact, in a recent scientific study that was published in the Journal of Bone and Joint Surgery in March of this year, 2013, patients who underwent total disc replacement were compared with those who underwent fusion procedures in their neck. They found that the patients who underwent total disc replacement had less neck and arm pain, they had increased range of motion, better neurologic function, they had a decreased incidence of adjacent segment disease, and very importantly, they underwent a fewer number of revision surgical procedures. Through a small incision, we're able to remove these herniated and degenerated discs at these 2 levels. By doing that, we relieved the pressure that was on her spinal cord and nerve roots, and we relieved her pain. Now that these discs were removed, we had an option to reconstruct either with a fusion or with an artificial disc. A fusion would eliminate the motion at both levels. An artificial disc would preserve the motion. Eileen chose, wisely, to proceed with artificial disc replacement, and that has preserved motion at both levels.
I think my overall demeanor has always been pretty good, but you just get accustomed. You lose little pieces at a time. It's not like one day you just lost everything and you're depressed. So the way you start losing your daily life is really in little pieces, like chipping away at ice. And before you know it, you look back and you can't do much of anything. And it was such a long process, and to have things brought back to you, you know, instantaneously was, yeah, it was a good thing. And it was a tremendous experience. I mean, the whole thing was nothing like I had expected, because we always expect the worst. I had my surgery, went home the same day, and I know the doctor doesn't want to hear this, but I was actually out in the garden the next day. I just, you know, I've never had a problem since. It was the best decision I have ever made. I can now resume all my normal activities.